We have dentists with us in the studio. Hey. Dr. Job Otieno is a hygienist.
Okay.
And then Dr. Dorothy Keegan is a general dentist. What's general dentist? As opposed to
specialist
dental surgeon?
dentist. Well, no, technically I'm a dental surgeon as well.
Okay.
When you do your undergraduate, you get a dual degree.
All right.
So my official title is dental surgeon.
Okay.
But there are specialties that you can go into. There are people who go into pediatrics, there are people who do braces, and so on and so forth.
I see.
So I'm the first line.
Okay.
General.
I thought general means the whole mouth. There are those who specialize in incisors, and then there are those who just go for the molars.
Well, there's always room.
Okay.
You never know what someone will come up with.
So, you'll tell us about what is this thing that you do, that you're a hygienist?
Oh yeah, dental hygiene, yeah. It's an aspect of dentistry which deals with the preventive portion of dentistry. And mostly we work alongside, in collaboration with the dentists and other dental professionals. So our job is to ensure that people are healthy first, so that they don't need dentists.
I see.
They don't get into pain.
I see. So you help us avoid painful futures.
Yes. We are the friendly portion of dentistry.
Okay.
That's where we're trying to take our focus, prevention rather than cure.
Okay.
Yes.
Siti will welcome you with the day's proverb. Please listen to the proverb, and then you'll give us your interpretation of it. The proverbs for this week have been from
the country of Kenya, the Republic of Kenya, the East African country of Kenya, etc., etc., etc.
and so on and so forth.
And so forth.
Yeah.
This is our final proverb for this week. All monkeys cannot hang on the same branch.
All monkeys cannot hang on the same branch. Dr. Dorothy, what's your interpretation of this?
Well, that sounds like resource distribution. That's what I would look at from my side. I'm trying to look at it from a dental point of view. But my initial point would be, you can't all do the same thing. You can't all have the same approach to things. Just the same way my colleague and I specialize in different things. You know, one person needs to do one thing, one person needs to do the other thing. If you all focus too much on one thing, that's a recipe for disaster. So all branches, focus on other branches, distribute yourselves. That would be my interpretation.
Distribute the monkeys.
The good doctor here has changed the proverb completely.
That's not my interpretation. I've given you.
No, I'm not saying it as though it's a negative thing. When you ask for your opinion and interpretation,
yes,
you're allowed to do what you like.
Very nice.
Yes, exactly.
I like that.
Okay.
Coming to you.
Job.
Yes.
So for me, I think I'd still concur with her. All monkeys cannot hang on one branch. That means there's a tree and there are other branches at the same time. So if they go on one branch, they might fall, all of them, or maybe they might break the tree. So I'm trying to imagine it's not good for or for people to depend on one source or just one thing. At least to see other things they can do, or maybe other places they can hold.
All of us can't be dentists.
All of us can be dentists.
Yes, but you actually contradict what she said. You don't quite agree with her.
But what she said is also true.
No, I'm not saying it's not true. Because what she said,
what is the contradiction?
The contradiction is, she said, all trees can't hang on a monkey. That's right.
Which is also true.
Okay. Let's start with the hygienist. So, what is dental hygiene?
So as I said earlier, dental hygiene is an aspect of dentistry. It's not big in Kenya yet, but most countries in the West and like in other countries, they're doing dental hygiene. So it's an aspect of dentistry that brings the preventive aspect. So a dental hygienist is someone who is a preventive specialist who does the preventive work. They help patients to take good care of their teeth. They help patients who are already having disease to help them manage it. Yeah. So if a patient maybe has seen a dentist and they are like, okay, how will I take better care of my teeth? How will I brush? How will I floss? What else do I need to do? Which products do I use? Yeah. Patients who have dentures, like, what do I do with my denture? How do I help? Like, how do I manage this? So they are preventing and also helping patients to manage. So most patients who go regularly
brushing teeth, basically,
taking care of the teeth and the whole mouth at large. Yeah.
Bottom line,
yeah.
So that you make sure that your teeth remain healthy,
and
so that you avoid going to Dr. Kigeno.
So that you avoid pain. Yeah.
Okay. You avoid the pain that
Yeah.
would come with it. I see. And then, when people come with pain, is all pain the same?
No, definitely not.
Okay.
Definitely not. Okay, so pain is interesting because pain is one of the most subjective things. If someone comes to me and tells me, by the way, I'm feeling a lot of pain, yeah, I can't tell you, no, you're not. All right? So it's and you can't measure it. We have scales, and I'll say, okay, how bad is the pain according to you? What is a 1 for someone might be a 10 for someone else. So let's start with that, yeah? So pain, it's mental in the sense that you're the person who's feeling it, and I have to trust you when you say, I'm in a lot of pain. So once that is and that's usually the starting point for a lot of people. It's really a culture for us. Because of that trauma around dentistry, you avoid it at all costs until you can't avoid it anymore.
You can't sleep at night.
That's the thing. So a lot of times we have people in the waiting room, umejishika, like you can tell someone is not all right. So we're trying to move away from the culture of letting it get to that point.
Okay.
When someone is coming with pain, what does it mean?
What do you mean? What does it mean?
Yeah.
Well, it means they're in pain to start
Yeah,
with. So what I will do...
Yeah, what's causing it?
So the first thing is I'll ask your history, because there are very many different causes, right? It could be from within the mouth. The most common things would be from the teeth or from the gums, for example. Less common things, there are wounds, we don't want to go into cancers immediately, but there's that. There's also trauma. You're in an accident. Rugby players, you got hit. Those are our most common sources. Yeah. So what I would do first is take a history, find out what happened, how long is it, how bad is it, and then we take a look, do our investigations, and then we see what we can do about it.
So the pain is a symptom of something. The pain is
always a symptom
the
of
pain is
something.
not the disease.
The pain is not the disease.
Right.
And that's something that people tend to, like when you're trying to manage it yourself, you'll take painkillers for a couple and then it's gone away, you think it's over. But the thing that was causing the pain is likely to still be present. So we have to find out what was causing it and then address that.
Are the things that cause the pain, the diseases that cause the pain, usually brought on by the individual? Is it things that you do that would cause a disease, or are they naturally occurring diseases?
Okay, so it could be one of either. Things are usually multifactorial. Human beings are very complex, and teeth are actually much more complex than you would think. So there are the habits that lifestyle. Let's say the way you live your life, the way you clean your teeth, the foods you eat. All those things can contribute to putting you in a situation where you're now in pain. You have an infection, you have this. Some things are naturally occurring, some things you can't help. For example, what we're talking about, trauma, Although even when we talk about that, like the sports players, there are things you can do to mitigate. Mouth guards, things like that, to try and protect
just avoid
yourself.
Fighting.
Avoid fighting, make good choices. Make good choices. Yeah.
Okay. So what are some of those things? I want you to name some of those diseases or some of those issues. If we start from here, that would get to here. What are some of those things that you say that would be causes of these pains? I mean, we've heard about them. Gingivitis, I don't know, cavities.
So usually I tell my patients 90% of the issues of the mouth are caused by bacteria. It's like the bacteria is the root cause of almost all evils in the mouth. Not all, maybe you could exclude trauma and maybe cancers and all that, but mostly it's bacteria. So every time we are living, we are controlling bacteria. That's why everybody is told to brush every day. And bacteria usually they multiply very fast. And when they multiply very fast, that means they are in your mouth all through. After you brush in minutes, they are back. You brush in minutes, they're back. Yeah. So the bacteria are the ones that initiate teeth decay. They're the ones that makes the gums to start bleeding. They're the ones that cause the gum disease. It's called gingivitis. Sometimes people who don't take care of gingivitis, it goes to a severe state, which is called periodontitis. So it's very important for one to control the bacteria. So it's the bacteria that causes most of those. Plus smelling mouth and most of the sores in the mouth, bacteria.
In terms of decay, sorry.
I was going to ask if those things can all be prevented.
Oh yeah, for sure. Most dental issues are preventable. Of course, they're preventable. By eliminating this one, you can eliminate the bacteria and also work on the diet. Because caries formation starts with it's the diet, a sugary diet, especially simple sugars, and then the bacteria. So when the bacteria feeds on the sugar, it produces an acid. That acid now demineralizes the tooth enamel and then causes a decay. So the tooth starts decaying. If you don't do anything about it early enough, it keeps on going until it reaches the nerve. Now that the pain comes.
Now, Job, many people will swear that they brush every day.
Daily.
Once, twice.
3 times.
then somebody in the same household,
Yeah.
somebody will have teeth issues, the other person will not. They eat the same things, they brush, they have the same habits. So what is this bacteria thing? Why does it choose me and not the other person?
I think that's a good concern, a very important one. So usually everybody's mouth are different. Their teeth are arranged differently, and the way they brush is different. You can just have the brush, but then you're not brushing all your teeth. You're just brushing one side, or maybe you want to make your smile brighter, so you just brush the front teeth only, and then you leave the back teeth. Yeah?
Technique matters.
Or at some point, you're just brushing like the teeth only on the out surfaces and the in surfaces, so you leave the in between. So the in betweens could cause cavities the same way it would have caused if you did not brush. So it's important for somebody to master to know the technique. And this,
Okay. Walk us through this technique, because clearly brushing teeth is not a
It's
brushing
not just brushing teeth.
Yes.
yes.
So what does one do?
So
You
on,
can straighten the mic as we.
so the tooth anatomy, on the tooth anatomy, the tooth has five surfaces. Mostly molars have 5 surfaces, yeah? So you have to brush the back of the teeth on the sides. So like it's the outer surfaces. So you brush the outer surfaces gently.
How do you brush it? Like
Up,
this?
I wish I had a brush.
Something to like
Use a pen.
Demonstrate, but
Use a pen.
the front and back motions usually they have a lot of friction. They have a lot of friction, and that one causes damage on the enamel
Well.
later on. Yeah,
Okay.
so it's important to brush just gently. Use a soft brush, and then what you're doing is just gentle brushing from put the brush at a 45
Circular.
degrees. Yeah, 45 degrees angle towards the gum, a little bit towards the gum, so that you're removing most of the bacteria that lodge around the gum, between the gum and the tooth. Yeah.
Okay.
So you're brushing in circular motion, gently, and then it's also important.
For how long?
At least 2 minutes. At least 2 minutes. Don't just do it.
And that's longer than you think.
2 minutes of
Point out.
2 minutes of.
Just 2 minutes.
It's 2 minutes.
That's
Okay.
a long
It is
time.
9:22. Continue talking. I'll tell you when 2 minutes are over.
So now I'm brushing while talking, but
Yeah.
okay, either way, it's 2 minutes. So what you do is from one side, just brush, follow a sequence. It's not follow a sequence because you don't want to miss any tooth, yeah? So just follow a sequence. It's like you're brushing 2 or 3 teeth at a go. You finish with the outer surfaces, go to the inner surface of your upper teeth.
Okay.
The same way. Point the brush towards the gum, 45 degrees, circular motions, gentle circular motions until this other side. That's 1 minute. Go to the lower teeth. The same thing. Circular motions gently, pointing the brush towards the gum a little bit, and then just circular motions gently towards till this other side. That's maybe 1 and 20 seconds. The inner surface is the same. Now brush the chewing surfaces. The chewing surfaces, you can just brush the front and back motions. Front and back, up, front and back, and then you brush your tongue. I don't know if
And
that's
don't forget the
understood.
tongue.
You brush the who?
Imagine 1 minute is not over since we started counting.
We were talking about it, we were not actually doing it.
Can you imagine if we were doing it?
Doing it.
And then why am I brushing my tongue?
Oh, CT.
So because
It's a surface in the mouth.
It's not a tooth.
Get stuck.
A tongue is not a tooth.
So are you telling me that dentists are tongue specialists?
they are the mouth specialists.
Mouth.
It's actually the whole mouth.
Mouth.
Yeah?
Your tongue is part of your mouth. Yes.
The tongue, in fact, the tongue is what distributes everything. Every food it distributes.
How about
all
the
of it.
palate, the upper part of the mouth?
The upper, you don't need to
No.
brush that.
You don't
Yeah.
don't brush that.
No, it's a smooth
The
surface.
mucosa is very smooth, so you don't need to. Nothing can get
Not
stuck.
as much. The tongue is not actually smooth, so there are spaces where food can actually get
Yeah.
lodged. So that's why we also recommend brushing that.
Okay. How far back into the tongue?
Till you
Well, you don't need to make yourself gag. Let me say that.
As,
Or should you
You
pull
don't-
it tongue
you
out?
know,
comfortable as
yeah,
you want
as,
to get.
as far as you can comfortably go.
Okay.
Because everything is a balance, like Joab mentioned as well. If you go too far, you'll also start causing problems, like extreme friction, overdoing it as well, because some people tend to, you're so concerned about, is my mouth smelling, am I clean, so now you're overdoing it. You're brushing maybe 4 or 5 times a day, so you're now going to end up noticing that your gums are actually receding, because gums are very delicate, so too much friction, they'll respond, they'll reduce, so
2
it's a
minutes are
balance.
over.
So there we go. 2 minutes about, yeah.
It's a long time.
I usually tell my patients, like, pick a song you like that you know is 2 minutes, and then just brush while that song is playing.
Okay. Now, what you've just described, that will prevent all these things you said may come my way by way of my having teeth.
Not on its own, there are other things you need to be careful about as well. So diet is a big thing. We all know, avoid sugar, the simple sugars especially,
Sure.
because simple sugar, the more refined something is, the easier it is for the bacteria in your mouth to eat it and produce the acid that my colleague was talking about. So extremely refined foods. And most doctors at this point in time will advise you against it. Whole foods are better for digestion, for everything. So the more refined something is, the more likely it is to cause trouble for you. So extremely sugary foods, extremely sticky foods, things that will stick and be hard to dislodge. And there's also the aspect of constant snacking, because every time you eat, you're introducing something for the bacteria to work on. So that's also something to be careful about.
This bacteria, it has uses.
It does. It's normal flora. It
Normal
is.
flora, yeah.
Normal.
It is. So there's normal flora, but then now within that same population, there are certain strains of bacteria that are associated more with gum disease and with decay. So you can't get rid of it entirely.
So essentially, our mouth is an ecosystem where,
It is.
where these things flourish.
100%. So you have to do the best you can to provide making it too comfortable for the bacteria that's there. Because you won't take antibiotics. There's nothing you can do to get rid of it entirely, and you're not supposed to. Again, even digestion. You have your normal flora. That's why people are not talking about probiotics and fermented foods and things like that.
Right.
But you don't want to make it too easy for them.
Okay.
Yeah.
So these Western habits like kissing should be avoided.
I'm not saying that. No one is saying that.
Why? Because you're kissing honey.
What I would suggest is be careful about the new bacteria that you're introducing to your mouth. So observe your person, the person that you're choosing.
So maybe you balance the
Hey. Yeah, you have to do some vetting exercises.
Shake hands.
Toothpaste.
Yes.
Why is it important?
Toothpaste is important. Okay, now this is going to be a bit controversial.
Yes.
All right. So toothpaste is important. I'm not saying don't use toothpaste, but eventually this conversation sometimes go to mswak. Our before.
Ile
Do you know what
muti.
mswak is? The chewing stick.
Yes, we do.
The chewing stick, essentially. Yeah. So the idea with the chewing stick is the friction to actually dislodge the foods, and it has been shown to be very effective in populations with a less refined diet. So again, talking about things that are extremely refined. So if you don't have very many sugars and someone is just there with a chewing stick, it is actually shown that it is good enough. The friction, it's technique, as my colleague was saying as well. So the friction, you've covered all the surfaces, you've dislodged all the food, well and good, your mouth is clean. So toothpaste comes in because there are more components that now help us work towards a cleaner mouth. So there's fluoride in most toothpastes, and there will be cleaning agents in most toothpastes. Sorry. So it's an additive, let's say. But, because people always ask, which is the best one? And a lot of the Western advertisements will say 9 out of 10 dentists agree.
Yes.
10 out of 10 dentists agree that you should brush your teeth. Use what is comfortable for you. If this brand is not working for you, then you're not going to use it because it doesn't work for you.
Okay.
So use what works for you best. If this is the one you like, as long as you're using it properly, go ahead.
Then there are those who tell you that, brush with toothpaste and then mouthwash.
Mouthwash has its place because he also mentioned flossing. So there's the idea about cleaning in between the teeth. The surfaces he talked about did not capture the surfaces which meet, where the teeth meet each other, but there are spaces there where food can get stuck as well. So there's flossing to disrupt the food that is stuck there. There are interdental brushes, which is like a very, very small, like a bottle cleaner brush that goes into the spaces. And mouthwash also does that because it's something that you rinse, water can go everywhere. There's also the water flossing, same idea. They're all aimed towards dislodging food that gets stuck within. Yeah.
Okay. When do you introduce toothpaste for children?
All right.
When can you? Because
can
before
you?
that, I remember their mothers would use a piece of cotton wool in salted water
Yes.
to clean the cavities. What would you cavity in this sense? I mean the opening,
space.
not
Yes, the oral cavity.
Yes. So when would you now say it's the best time to do that?
All right, so hygiene actually starts from the very beginning, before the teeth even come out. We try and encourage our mothers, when they're still just the gum pads, like you're talking about actually, it's the cotton wool or a clean cloth, salty water, just rub the surface gently, and that's it, you've done that. Once the teeth start coming out, again, still the cotton wool, just going over the surface with cotton wool and salt water is fine. Once the child is old enough to start holding a brush, you do it with them. At that point in time, maybe about, let's say, a year and a half, because it depends on what is available
Once
to
the
you.
teeth
Let me say that. Once there are teeth in the mouth.
Okay.
So there are toothbrushes that are targeted even at very small babies, but those will not always be available to everyone, and they're usually extremely costly. So if you don't have it, again, don't be fixated so much on the tools that are there.
Okay.
So use what is available to you. That's what I'd say. But if you are introducing toothpaste, make sure, for this particular one, I will say, make sure the toothpaste is targeted to that particular age group. Because kids will swallow.
Yeah,
Even
they'll swallow
benefits.
it.
Yes. So it's formulated to be safe enough to
For them to
swallow.
swallow.
Yes.
Until
But
we
an
understand
adult...
the concept of
And of
spitting it
spitting,
out.
yes, exactly. And then again, kids' toothpaste are usually flavored,
yeah.
so it's sweet.
It's
The
sweet.
first thing they'll do is swallow a bit.
Sure.
Yeah.
But the
so,
activity of getting them to do it is what is important at that
yes, yes.
point. Okay. I heard somebody say the other day that actually maybe it was many months ago, her son had cavities. And she said, well, you know what, that's fine. I'm not going to go to the dentist to have them filled because those teeth are going to fall out anyway at some point. So, we are fine. We're just going to keep brushing. They're going to shake and fall out. Is that dangerous?
That's so dangerous. Like, I'm actually feeling pain when you're saying that because I've seen so many people with that same situation where they'll talk about, but sizina toka. So, okay, fine. Yes, the milk teeth are going to come out at a particular point in time. But what a lot of people don't realize is that, teeth come out at different times. So the first teeth that start getting lost is the front teeth, about age 4, age 5. So those ones will come out, the other ones will grow. But the back teeth are kept for much, much longer than that, up to about age, let's say 8, 9, 10, maybe even 11, maybe even 12. And they have a purpose in the mouth. Number one, there's chewing, obviously. So if your child can't chew properly because of the cavities, they literally can't chew. It is painful for them to chew. Imagine if you, every time you are eating, you're feeling pain. Like, why are you letting your child go through that?
Yeah.
Fine, they will shake and they will come out. But like that, the quality of life for your child, really,
It even
yes.
affects the nutrition.
At the
Yeah.
beginning,
So failure to thrive is there. And then also the presence of the milk teeth guides the growth of the bone. The bone of the jaw grows with the tooth. If this tooth has been lost so early, that particular point, that small segment is not going to grow the way it is. And a 4-year-old jaw is not the same as a 9-year-old jaw. So in order for the jaw to expand, to create enough room for the permanent teeth to come out, that milk tooth has to have been there.
Right.
So that is such a common thing. And on the way I'm talking, really, like, I genuinely feel so bad when parents say that. And you're setting your child up for problems for life. You see, the same way when we came in, you say, I don't smile in front of a dentist. You have that association.
Yeah.
And you're setting your child up for a painful life with the dentist. Like, ideally, we want it to be, you come in once or twice a year, we do your checkup. Your teeth are very clean. Is there anything you want to do in terms of, do you want to brighten them? Now we are doing the good stuff, the cosmetic stuff. We're all comfortable. But if every time you're coming in, okay, I'm in pain, like, it's not good. Even us, we don't enjoy inflicting pain on. Contrary to popular belief, we don't get into this because we are sadists. We do actually want to help people.
Our guests this morning are dentists. Dr. Dorothy Keegan is a general dentist. She makes her money by coming and sorting you out when you have problems and also advising you on what to do. But Dr. Joab Otieno is the one who makes money by just talking to you and telling you, by the way, fanya hivi. He is a dental hygienist. Yeah. We are talking about taking care of our dental health and just taking care of our teeth and why it's important to do that. This is our Health Friday conversation. Many questions on our YouTube channel. Please keep them coming. How do you whiten your teeth? Is there any effect? You'll talk about that. How do you clean the inner side of your teeth? King Dave is asking, is there any danger to using the Masai toothbrush stick? No, Bana. That is, in fact, what Dr. Dorothy said. In fact, if you can get it, talk to me. I'll get you several. I'm going to Kimana this weekend. About whitening teeth.
All right, so whitening teeth, you'd have to start with what is the cause, right? Because when you're talking about I want my teeth to be white, that means there's a discoloration. So first you have to figure out the discoloration itself, and then I'll know what to do about it, right? So common discolorations, that can be external stains, things that come from coffee, too much tea, red wine, highly pigmented foods. That can be taken care of by cleaning. Technical term is scaling. My colleague can speak more about that because that's now his area, kabisa. Then now, if there is no external stain, then now you look at the teeth itself. So at the moment in our population, the thing that's causing most discoloration is fluorosis, which is the browning of the teeth due to the water intake, maji ya chumvi, right?
Yeah.
Everyone is familiar from it. Back in the 90s, we knew it was in Nakuru, Labda Coast, but it's coming to Nairobi a lot because of all the boreholes that are being sunk all over. So everyone's water is salty. We're not so sure about the quality of it. So if a child's water intake, drinking, and the water that's being used to cook, let me emphasize that because that's something a lot of people miss.
Yeah,
even the
because
water that's used to cook.
when you're cooking, you've boiled the water.
Exactly.
so
So that's also that's also a thing.
Right.
So if that water is extremely salty, the fluoride displaces the calcium while the teeth are being formed, and they come out with that brown staining.
So let me understand, because I'm speaking personal experience here. So dentist told me that so with one child to the next child, first child didn't have a problem, she was fine. Second child, then he could start to see the browning, because I was in an area where the water was different. But the water that we drink is different from water that comes out of the tap. It's filtered differently. And so he said, you know what? The water that's being used to cook matters. The water that you use to wash your vegetables, wash your fruits, whatever matters. And so he said, change that as well. So we used a different kind of water to cook as well. And we could see that the browning.
So you purify all the water
all
that's
water
being
that
used.
you drink, even water to brush the teeth with, all of
Because you'll
this.
swallow a little bit of it, probably.
Right. So I actually saw that it reduced significantly. And then he said, what you do is that when he's 12, bring him and then we can do a whitening.
Yes.
But then
Yes.
maybe I should have asked then. Somebody who asked questions, I don't know why I didn't ask him then. Anyway,
What's the question?
why do we have to wait until he's 12?
All right. Okay, so veneers is essentially what we talk about, right? So ideally, there's permanent. Okay, we'll go into a bit of the technicalities here, right? So there are different materials that are used to do veneers. For someone who's actually under 18, the material that we would use over to cover the tooth is the same material that we use to do the normal white fillings, right? So we would basically, we call it masking. That's like the colloquial term amongst us. So you're essentially gently drilling off about 1 millimeter of the tooth. It's painless. You don't even need to do it under the local anesthetic. If depending on your child's tolerance, let me say, which again, everyone is different. It's not that your child is being a bad person.
Right.
If they can't handle it, they can't handle it. That's fine. We'll deal with it. So usually we used to say 12, but now I've done it on people who are younger as well, up to about 8 or 9, because if the brown is really bad, then now, even if it's just not the most ideal, you just drill off that brown part and put the white filling. So you can actually do it earlier, but we try and hold off a little bit, because every time you drill a tooth, everything comes with cost and benefit. Like you have to do a cost-benefit analysis, right? Every time you drill a tooth, there's a risk, no matter what. It may be a very small risk, but there is a risk. There's a risk of sensitivity, there's a risk of developing decay in that area, provided let's say the maintenance is not so good. So every time you do it, you'll have to come back and do it again. And again, the white material that we use under age 18 tends to pick up stains as well. So you do it, each case is different, right? If it's not so bad, if it's not affecting your child, they can talk, they can laugh, they're fine, then you do want to hold off as long as you can.
But it's more of a social issue, because kids are
very
mean.
much is. Exactly. So if you notice now, when your child is talking to you, they're not laughing in photos anymore. They're covering their mouth. I mean, in that case, it's justified, because now it's affecting them. Exactly, self-esteem.
Yeah.
Plus, at the same time, at 12, like when they're still younger, their teeth are also growing. So you can do a masking on a tooth that is still small, and then after a few years, it becomes big.
More of it
So
has
then
come
it's
out.
so more of it has grown with the tooth, and then leaves another space of maybe a discolored tooth.
What is this process of whitening teeth? Are you removing something from the tooth, or are you putting something on the tooth?
So that's why I started at the point of you have to look at the cause. So if it's fluorosis, you cover it essentially, because no amount of bleaching, which is where I'm going to go to next, will change that if it is severe fluorosis. So if
So
that,
what do
none
you
of that,
put on it?
if
Paka rangi
there's
white.
fluorosis. No, there's a material that we use. There's the white filling material is what we use for someone who's over 18. Growth and development of the jaw is complete. Then we do ceramics. Those ones are the best. They're very color stable. You do it once, as long as there's no trauma, there's no recurrent decay. That's very color stable. It's the best.
Okay.
But because you don't want to wait until 18 with your brown teeth, you do something before. There is also bleaching. If the issue is just the yellowing of the teeth, which is something that occurs naturally over time, then there are materials that we apply to gradually brighten the color of the tooth. So there are different kinds. You can do one session in the office, you can do at-home kits. They are safe, but you really have to do a proper workup first. Like you have to do a full examination, because if you have any gum disease, any inflammation, any decay anywhere, it is a strong chemical, you will have bad side effects. But if everything is okay, then it's very safe. So we usually encourage people, please go to a dentist first, do a full checkup. There are those advertisements, I don't know if they're still in matatus, but we used to see them, utoto sticker, we whiten brown teeth.
Yes.
Please be careful about who you're going
Very
to.
nice photo.
And then it might be AI at this point in time, please be careful about who you're going to.
And the product products they're
Yes.
using, because this
Yeah.
product, what happens? The products are made to suck or maybe to absorb the stain, the yellow color, and then leaves the tooth white.
Right.
Okay, there are quite a number of questions here, and some of the ones that are coming up. First of all, maybe the ones for you, Doc. Should you? What's the benefits of using charcoal to clean teeth? Not necessarily the one in the thing, but there's even charcoal toothpaste now. What's the benefit of that,
So,
and does it work?
So charcoal toothpaste are good. They absorb, and they tend to make teeth white if you use them for a very long time. But then that is usually it's an effect, because people start using charcoal, and at the same time it's very abrasive. Now it harms the teeth in the long run. So it's important, even if they want to use the charcoal toothpaste, they should not use too much of it. Plus, before they use that, I think it's recommended they come to the dentist. They should be seen first, to see which products would want or what they want to achieve at the end. But most of these products, some of them they're not safe for sure, because at the end of the day, they try to whiten their teeth, and at the same time, the teeth, instead of turning white, they turn yellow, because they end up scraping the whole enamel. And we know the enamel, the outer part, is the white part. So if the white part is scraped off by the action of brushing and using very abrasive toothpastes, at the end of the day, the white part wears off, leaves the tooth yellow
Wow.
in the long run.
Okay.
The thing with charcoal also, because again, there have been studies to notice that there is an effect. It's the carbon. You know how carbon is used in filters as well, so it absorbs impurities. So that's why there is actually an effect in it. But the issue is that, like, if you're just doing actual charcoal, it's not calibrated, you don't know the amounts, it can be too abrasive, as my colleague is saying.
Okay.
And the ones that are in toothpaste will be, it'll have a slight effect, but not as much as a professional bleaching. Let me also just say that, because there's a limit to what can safely be sold over the counter and in supermarkets.
Okay.
So if you really want a clear effect, then go to a professional.
Okay. There's a pain radiating from my zygomatic bone
Right, that would be like here.
all the way to the temporal bone after extracting my tooth. Is it normal or a complication?
How long ago was it? Sorry. I mean,
I can
clinical
pretend.
terms. Yeah.
Okay, 5 months.
Because that's the first question. How long ago? Okay. So pain after an extraction, let's look at it that way, right? And I would also like to emphasize, this is not a substitute for an actual, one-on-one with a dentist. This is just a general impression, right? So pain after an extraction could be any number of causes. So that's why I asked first, how long ago was it? Because if it's still part of the normal healing within a certain range of time, it's acceptable. But if it is extremely severe, there's a possibility that there was an infection, so you need to go and get that checked out. There is also, again, a possibility of nerve damage. Not likely with the upper, if I may say. That's a bit more common for the lower, and it's still very uncommon. There's a possibility there was an issue with the sinus, if you're talking about the upper, during the process of the extraction, if it was very rough.
Wow.
If it was very rough, there is a possibility. So all these things are possibilities. I would say that pain in itself is not normal. Remember when we started at the very beginning, pain is a symptom. So if you are feeling pain, you're within your rights to go back to the people who did it and say, okay, by then I'm still in pain. What's going on?
Okay.
Don't sit with pain. Let me just say that.
What would be the cause of impacted teeth? Is that natural?
All right. Yes. So what an impacted tooth is, in case someone doesn't know, it's a tooth that hasn't erupted completely, either partially stuck in the bone or fully stuck in the bone. Many different causes, not fully understood. Most commonly, the assumption is that it's due to a discrepancy between the size of the teeth and the size of the jaw. The jaw did not reach its full potential of development. Again, coming back to our refined foods. So whole foods, miwa, things that need a lot of chewing, things that need proper chewing, your muscles work. So if you're eating a very good diet, apples, hard foods, carrots, things that need to be chewed, your muscles working encourage the jaw development to reach its full potential. A lot of people in the modern situation are not reaching full potential of your jaws.
Okay, I
Yes,
have
I'm
impacted
listening.
teeth.
Okay.
I have impacted teeth. Dentist said I have to remove all 4 of them.
Yes.
I removed the first one. It was horrible.
Bad experience.
This is why when Eric
so sorry.
said
We're doing
Remove
dentist.
means what?
they had to cut into the bone.
So the tooth is inside the jaw.
Yeah, if
So the
it's
growth
half
is there.
in. It
So
didn't
the
fully
removing it,
emerge.
what are we doing? Are we cutting the jaw?
They have to
Just
cut
just that portion
This
alone.
question, it seems more
It
painful
sounds
than
so
the
bad.
procedure.
Yeah.
She says when she says just cut,
that.
I am here.
I'm sorry.
I'm here. I'm telling you that it was not just so.
I know.
So then they said
It's
remove
so
the other.
bad.
I've not gone to remove the other ones, but then now this one here is growing down,
Yes, that does happen.
right? So can you? But if you're saying, because I didn't have problems chewing carrots, apples, anything like that, it's fine. The only thing that happened is that it was a closed off part, so I got a cavity there because of that impaction, and that's
You
how we
couldn't
even
clean it
knew that the
properly.
teeth were.
Yeah, the others.
Nothing could get in there, so that's why they had to remove it.
Yeah.
So can you then operate with impacted teeth without having them removed? Must you have them removed?
Opinions on this change. So there's some people, you can get away with it if you can clean it, is the thing. Not many people are meticulous enough with the cleaning. Maybe not necessarily through your fault. If it's just stuck that badly, like the point at which it's contacting the next tooth is below the gum line, you'll never be able to clean it. Food will be getting there, but you can't clean it. So in such a case, yes. You again, cost-benefit analysis.
Yeah.
It's posing more of a risk to the other teeth in your mouth than it is by remaining. If it's partially come out, and you're able to clean it, it's not causing any other issues, you're not at a high risk of developing decay, then you can. But I would really, again, emphasize, you need to do annual checkups. Because for impacted teeth, the problem starts really quietly until the day it explodes. Because it doesn't come with the initial warning signs of sensitivity that the other teeth have. It just comes with one day you can't sleep. Like your mouth has just exploded. So frequent checkups. So even you, as you're being afraid of God, I'd suggest you go back. Just get the x-rays done. Just see what's going on.
I've seen them.
Keep going.
When was the last time?
Keep going.
6 months ago, actually.
So you do another one. Yeah. X-rays are good for 6 months according to us because the picture changes.
Yeah.
You know, the condition in your mouth right now is not the condition it was 6 months ago.
Okay. So another question here. Every time you have a problem with your tooth, should you actually have them? How safe is it, and how many teeth can you remove and still remain? Because somebody says a cavity at an older age, remove it. Because how many should you remove and still remain? Yeah.
I think it's
A
important. It's important.
Remain a human.
It's very, very important to preserve your natural teeth. Usually, back then, dentists were daktari wa kung'oa meno. It was like you go with pain, they just extract the tooth. So that was the idea back then. But nowadays, there are ways to save your teeth. There are ways to even restore the teeth that maybe that are decayed or painful. Yeah. So that's why it's important to get checkups as early as possible. Once you start feeling even before you feel the pain, when you're going for these checkups, of course, it's identified early. But once the pain is there, don't remove the tooth first. Go seek an opinion. Of course, you can do fillings, you can do root canals nowadays, and there are even other ways to save the teeth. Yeah.
Okay. There's a question here. Sorry, there are many.
Yep.
She's asked this question. I think she's asked a couple of times. We're not able to make the connection. What's the correlation between painful gums when on your period or when pregnant?
All right. Okay. So I'll start with the pregnant one because that one has actually been documented. There's pregnancy gingivitis. The female reproductive system is very interesting. Like a lot of things go on, and it's not fully studied. Let me also point that out. But there has been an established correlation between a higher risk of gingivitis and gum disease during pregnancy for some people. And you will hear a lot of people say about with every child I lost a tooth.
Yeah.
That's a very common, old wives' tale, but the old wives knew what they were talking about. So when someone is pregnant, we do still recommend. Bas, exactly. And you know which tooth it was. So the theories are your body's at a for pregnancy, the theory is that your body, there's generally more inflammation going on because your body is trying to accommodate a whole other different organism. So everything is just all over, and an increased loss of calcium. Also, again, habits during pregnancy. If you're someone who needs to keep snacking, so your hygiene will drop a little bit. There's also hyperemesis, which is people with really bad morning sickness. If you're throwing up all the time, that's a lot of acid on your teeth. So yes, so that's something that's known. So you can actually see the dentist while you're pregnant. Most people think you can't, but you can actually. Some things are quite safe to do. Okay. So don't think you have to sit on it until afterwards. You don't want to get to a situation where things are really, really bad.
Can you do something about it?
At the time,
if someone comes to you, they're pregnant, and they have all these issues
you can have a filling done, you can even have a removal done, to be honest. Cleaning. You can do an initial part of a root canal, you can do cleaning. Most of the things are very safe to do. We'll just take those extra precautions, find out how is your pregnancy going, do you have any other issues, hypertension, all those things that are there. But it is actually safe.
Something here we need to talk about, cost.
Yeah, that's a big one. That's actually a very valid point.
Meno ni yako.
Meno ni yangu.
Na naitoa.
And then nalipa yeye. Natoa meno yangu.
Kutoa mwenyewe.
Yeah, that's actually a barrier to treatment for a lot of our
Why should
people.
it be a barrier?
It should not be, to be honest. Now, we're going to go into a lot of almost political things right now because healthcare as a whole in the country...
You don't like politics?
No, that's why I got into science. I know what I'm doing. It's studyable. We are not trying to convince anyone of anything. So, healthcare as a whole in this country is not in the best condition at the moment. And I said I don't want to go into the politics of it. But speaking about what I know, so our costs are likely to actually continue rising, unfortunately, because of the materials that we use. None of these materials are made in the country. They're all things that have to come in. And now bringing things into the country is not cheap. Things that were medical, which could come in without certain kinds of duty, things are changing in that particular aspect. So that is unfortunate. But... well, I'm not supposed to do this, but so there are cheaper options, right? But I would still, suggest. Okay, one thing I usually talk about for a lot of my clients, the dental school actually at University of Nairobi is a very good resource because they do have what's the word I'm looking for? Like the costs are slightly lower, subsidized. Thank you. So you will do a bit longer in terms of it'll take a bit longer, and people are always a bit iffy about, but it's teaching, wanafunzi hawajui. And if I may say, that's also the problem with the recent interns issue. People want to say, ni wanafunzi hawajui, but it's part of the training, and no one is working on their own unsupervised. That is still very valuable. That's still very important. So the cost is not likely to come down, but I would say, we usually tell people, look at it as an investment. There was that question about how many teeth are safe to lose. There's actually, one of the lecturers is doing a 70-28 campaign, where the idea is you get to 70 with 28 teeth, meaning the 4 you lost were the wisdom teeth. So any tooth that is functional in your mouth that you lose is a loss. You cannot chew the same way you used to chew. Your balance is not the way it used to be. You can end up with joint pains. So your teeth are very important. It's an investment, actually.
Does the Aga Khan University have a dental school?
No, it doesn't. We do want to start one, though. It started at university for medical school. We are writing our own proposals on what we can do about that.
And we have a dental hygiene school.
Yes,
so we have a dental
that's coming up.
Why is it, therefore, then, that the preventative aspects of dentistry are not talked about louder, emphasized more, talked about during health talks, because health facilities do have health talks. The focus, again, usually is mothers who tend to have it, my expectant mothers. But it's something, because even when we look at our whole approach to healthcare, the preventative aspect takes a back seat.
It really does. It really does.
And actually, even when we see it from the toothpaste companies. They're the ones that are, just
that's marketing. That's a marketing
they're
budget.
doing it for marketing.
So they're doing a
from
good
the
job for sure. We try to raise awareness. It's just the lack of information. The lack of information to people, because of the previous generations who passed these informations to us, they were just like, and you go to a dentist when you get pain. But then the preventive aspect of people not waiting for that pain has not been there. So we are just trying to change the narrative. That's why we usually try to go to schools, we're educating them, we go to functions, we go to events, as Aga Khan, of course. We just try to maybe raise a generation that is aware of all these things.
Have you spoken to the Kenya KICD, Institute of Curriculum Development? Why am I saying this? Some of these things are things which, if they are taught, and then when
part
you
of the
come
curriculum
in and talk, you augment what is there. Children will take this information seriously and they will apply it. So you end up having an entire generation
that has been taught.
Yes, and who's...
So I remember when I was in primary school, I think there were guys from Colgate who came to our school back then in the 2000s, and they taught us how to brush only, But then growing up, I realized that these people, I don't know who, like the way they were teaching people to brush, I think that was what was relevant at that time. But then things are changing right now. So I think they need professionals who are able to educate the masses, who are able to do all these things. And getting that, of course, will take some time.
That's why I mentioned the Kenya Institute of Curriculum Development.
I like that. That's a very
so
good.
we'll, I
so
think
that it's actually included in the curriculum.
At the very beginning.
You have a Kenya Dental Association.
Yeah, there is this KDA.
Right?
it does a good job, for sure.
With outreach and things like that. But again,
Once again, it will be limited.
Yes, because we're few. Also, that's also an issue.
You see,
The
there are
dental
schools-
population.
the
there are schools
ratio.
all over the country.
Yeah, the association, then what I'm bringing the association for is it can lobby KICD
Yes.
as the dental association
For that.
and say there's importance to have this, have a conversation at the Ministry of Education, then at KICD. In the curriculum review, can we add some of these health factors so we can have, elements of dentistry, elements of, we have all those
Nutrition as
things,
well.
nutrition, everything, so kids grow up knowing this.
They're a listening group of people. They listen.
Yeah, very much so. A lot of, no, this is going to be very middle class, but a lot of my, the parents who come to see me talk about the videos on YouTube and things. The songs about brushing. That's how they get their kids to brush. So kids they absorb. Children are sponges. So if, that's actually a really good idea. If they're taught at that point in time and it's retained. So, and also this forum that you guys have as well, I must commend you for that. Because this is also, your outreach right now is probably a lot more than
Could
the
you
people
repeat
that
what
I
you
meet.
just said?
So I commend you very much for that.
Yeah, for sure.
This is a really good platform because the people I'm talking to right now, usually I have my one-on-one with my practice and you tell someone, each one teach one. So you say, okay, in your estate with your family, tell them this about the water. But this is such a big forum. It's much better than nothing.
You said each one or each one?
Each one
One
teach
teach
one.
one.
Okay. Thank you very much, Dr. for joining us. We've had a Health Friday conversation, very enlightening, but you guys need to come back because
Yeah,
we've
sure.
just begun and there are very many
But there's
questions.
so much. It's
We will do
very,
this.
very wide.
We will do
Please
this.
invite us back again.
Dr. Dorothy
No
Keegan is a general dentist and a general hygienist. Dr. Job Otieno, they've been our guests.
This is the Situation Room, the only way to start your day.